Welcome to our channel, where we dive deep into the world of health and wellness to empower you with knowledge. If you're looking to take charge of your well-being and make informed decisions about your health, you're in the right place. Our videos are crafted to enlighten and empower you on your journey toward better health. Whether you're seeking expert advice, practical tips, or simply a deeper understanding of healthcare topics, we've got you covered. Hit that subscribe button to become part of our informed community and gain access to exclusive content designed to elevate your well-being. Be sure to stay tuned for another informative and engaging video. Today I will be talking about antimicrobial resistance, AMR. What in the world is antimicrobial resistance? Antimicrobials are medicines used to prevent and treat infections in humans, animals, and plants. Antimicrobial resistance occurs when bacteria, viruses, fungi, or parasites resist the effects of available antimicrobial medications. This makes it easier for infectious diseases to spread and to cause more severe illnesses and deaths. In the US, the most pressing concern is a growing resistance to antibiotics, medications that eliminate toxic bacteria. Much of this can be attributed to misuse, in particular, expecting antibiotics to fight viral infections. For patients, the effects of overprescribing range from inconvenience and unnecessary expense to increased susceptibility to life-threatening infections and other serious health concerns. For communities, livestock, and the environment, overuse of antibiotics leads to antibiotic resistance, in which toxic bacteria evolve to evade existing medications. More than 2.8 million antibiotic-resistant infections occur in the US each year. Tens of thousands end in deaths which might have been prevented through better stewardship. Antimicrobial stewardship is a collective responsibility of all of us, clinicians and patients alike. We all need to participate in the conservation of the available antimicrobials by prescribing them only when needed and not using them indiscriminately. Thus, we can continue to control further emergence of resistant microorganisms and be able to treat patients effectively. Everyone has a role to play. There are some simple things that everyone can do to help prevent antimicrobial resistance and to safeguard antibiotics for when they will be most effective. First, when you or your child is sick, get advice from your primary care provider or nurse helpline. Acquaintances on Facebook or your next-door neighbor are well-meaning, but your healthcare team will offer evidence-based care. Then take that advice. If you are prescribed an antibiotic, use it as directed. When antibiotics are not used as directed, the harmful bacteria may build a resistance to that medication. This can hurt you. And when those resistant bacteria return to the environment, they then contribute to the global reduction in antimicrobial effectiveness. Also, don't take something that was not prescribed to you for your current diagnosis. In the fall and winter, we typically see an upsurge of upper respiratory infections and patients desperate for symptom relief. No matter how much we want to have a drug that wipes out these miserable infections caused by viruses, like the common cold virus, influenza, or RSV, antibiotics are not the answer for them. Now we have COVID-19 added to the mix as another source of cough, fever, and other overlapping symptoms. Unfortunately, this too is a viral infection that does not respond to antibiotics. Patients are not without options. Many over-the-counter medications can be very effective in treating symptoms. Your primary care provider or your local pharmacist can help you find the ones that will work best for you or your child. Before you get sick, seek prevention. The third, but possibly most important, thing everyone can do to help prevent antimicrobial resistance is to take steps to reduce their likelihood of infection. Exercise common infection preventive measures, such as hand hygiene, covering your cough, staying away from work when sick, and getting vaccinated. Wash your hands by rubbing them together with a soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Get all recommended vaccinations for yourself and your loved ones according to your age and medical conditions. Why risk a disabling or life-threatening infection when an effective prevention tool exists? And why not take that simple step to help avoid serious infections and the dangers of potentially unnecessary antibiotics? And don't forget the other day-to-day ways to prevent infection. Practice safe sex. Be mindful about safe ways to prepare and store food. Avoid sharing items like a toothbrush, lip balm, or water bottle. Remember, seek medical advice when you are ill. Follow that advice. Safely dispose of unused medications. Do your part to prevent or reduce likelihood of infections. Get vaccinated. Thank you for joining us on this journey of health and wellness discovery. We hope you found this video insightful and empowering. To continue learning and growing together, don't forget to hit that subscribe button and ring the notification bell so you never miss out on our latest content. We value your input and would love to hear from you. Share your thoughts, questions, or suggestions in the comments below. Let's spark meaningful conversations and support each other on our paths to better health. Remember, knowledge is power, and together we can make informed choices that lead to a happier, healthier life. Join our community of health enthusiasts and let's inspire each other to thrive. See you in the next video.